Question 1. Risk assessment procedures indicate that the physician practice needs to develop a comprehensive emergency preparedness and response plan. Which of the following initial steps is the most critical for establishing an effective plan? Option A. Develop a generic emergency response training program for all staff members. Option B. Conduct a thorough hazard vulnerability analysis, HVA, to identify potential threats and their likely impact on the practice. Option C. Purchase a comprehensive suite of emergency response equipment based on industry best practices. Option D. Review and adapt emergency plans from other physician practices in the region. Correct answer is B. Conduct a thorough hazard vulnerability analysis, HVA, to identify potential threats and their likely impact on the practice. Explanation. Scenario analysis. This scenario presents a common challenge for physician practice managers, balancing the immediate need for a functional emergency response plan with the practical constraints of resource allocation and the dynamic nature of healthcare threats. The core difficulty lies in identifying the most impactful and feasible initial steps for developing a robust plan, especially when faced with limited time and budget. A physician practice manager must exercise sound judgment to prioritize actions that yield the greatest benefit in terms of patient safety and operational continuity, while also adhering to relevant regulations and best practices. Correct approach analysis. The correct approach emphasizes a systematic and comprehensive assessment of potential risks specific to the practice's location, patient population, and services offered. This aligns with the fundamental principles of emergency preparedness, which mandate a thorough understanding of vulnerabilities before developing mitigation strategies. By identifying potential hazards, e.g., natural disasters, public health emergencies, security threats, and assessing their likelihood and potential impact, the practice can then tailor its response plan to address the most probable and severe scenarios. This proactive, risk-based methodology ensures that resources are directed towards the most critical areas, maximizing the effectiveness of the preparedness efforts and demonstrating due diligence in safeguarding patients and staff. This approach is foundational to regulatory compliance and ethical responsibility in healthcare management. Incorrect approaches analysis. Focusing solely on acquiring specific equipment without a prior risk assessment is a flawed approach. This is a reactive measure that may lead to unnecessary expenditure on items that are not relevant to the practice's actual risks. It fails to address the broader spectrum of potential emergencies and may leave critical gaps in preparedness. Ethically, it prioritizes tangible assets over a strategic needs-based plan, potentially compromising patient safety if the acquired equipment doesn't address the most likely threats. Prioritizing staff training on a generic emergency response protocol without tailoring it to the practice's specific environment and identified risks is also problematic. While training is crucial, a one-size-fits-all approach can be inefficient and ineffective. Staff may not be adequately prepared for the unique challenges they might face, leading to confusion and delayed or incorrect responses during an actual event. This approach neglects the critical step of understanding the practice's specific vulnerabilities and the necessary adaptations to a general protocol. Implementing a plan based on what other similar practices have done without conducting an independent risk assessment is a significant oversight. While benchmarking can be useful, it does not substitute for a thorough analysis of the practice's own unique circumstances, patient demographics, and geographical location. What works for one practice may not be suitable or sufficient for another, potentially leading to a plan that is either inadequate or overly burdensome. This approach risks overlooking specific local threats or failing to leverage the practice's unique strengths. Professional reasoning. Professionals should adopt a structured, risk-based approach to emergency preparedness. This involves 1. Conducting a comprehensive hazard vulnerability analysis, HVA, specific to the practice's context. 2. Developing a tailored emergency operations plan, EOP, that outlines roles, responsibilities, communication strategies, and specific response actions for identified threats. 3. Implementing training and drills to ensure staff proficiency. 4. Regularly reviewing and updating the plan based on new risks, lessons learned from drills or actual events, and changes in regulations or best practices. This systematic process ensures that preparedness efforts are targeted, effective, and compliant. Question 2. The control framework reveals a significant and sustained shift in the patient population's payer mix, with a notable increase in patients covered by government-funded insurance programs and a corresponding decrease in those with private commercial insurance. As the Certified Physician Practice Manager, CPPM, what is the most appropriate initial strategic response to ensure the practice's continued financial viability and operational effectiveness within the U.S. healthcare system? Option A. Continue current operational strategies without significant changes, assuming the practice can absorb the financial impact of lower reimbursement rates over time. Option B. Immediately implement across-the-board budget cuts, including reducing staffing levels and limiting the availability of certain diagnostic services to offset the anticipated decrease in revenue. Option C. Conduct a thorough financial analysis of the current and projected revenue streams based on the new payer mix. Explore opportunities for optimizing billing and collection processes for government payers, and develop strategies to attract and retain patients with high reimbursement commercial insurance, while also evaluating the cost-effectiveness of current services. Option D. Focus exclusively on increasing patient volume by expanding marketing efforts, without a detailed assessment of the payer mix of new patient inquiries. Correct answer is C. Conduct a thorough financial analysis of the current and projected revenue streams based on the new payer mix. Explore opportunities for optimizing billing and collection processes for government payers, and develop strategies to attract and retain patients with higher reimbursement commercial insurance, while also evaluating the cost-effectiveness of current services. Explanation. Scenario analysis. This scenario presents a common challenge for a physician practice manager, PPM, in the United States healthcare system, navigating the complexities of payer mix and its impact on financial viability. The challenge lies in balancing the ethical imperative to provide care to all patients with the business reality of managing a practice that relies on reimbursement from various sources. A significant shift in payer mix, particularly towards lower reimbursement government programs, can strain resources, affect staffing, and potentially compromise the quality of care if not managed proactively. The PPM must exercise careful judgment to ensure the practice's sustainability without compromising patient access or quality. Correct approach analysis. The correct approach involves a comprehensive analysis of the current payer mix, projected financial implications, and strategic adjustments to mitigate risks. This includes understanding the reimbursement rates for each payer, the administrative burden associated with each, and the long-term financial sustainability of serving a predominantly lower reimbursement population. Best professional practice dictates a proactive, data-driven strategy that might involve exploring new patient acquisition channels, optimizing billing and collections processes, negotiating with payers where possible, or even considering service line adjustments. This approach aligns with the ethical obligations of a PPM to ensure the practice can continue to operate effectively and serve its patient population, adhering to principles of sound financial management and responsible stewardship of resources, as implicitly guided by professional standards and the need for operational integrity within the U.S. healthcare regulatory environment. Incorrect approaches analysis. One incorrect approach is to ignore the shift and continue operations as usual, assuming the practice can absorb the financial impact. This fails to acknowledge the financial realities of healthcare reimbursement and the potential for operational deficits, which could lead to service reductions or practice closure, ultimately harming patient access. This approach is ethically questionable, as it risks the practice's ability to provide ongoing care. Another incorrect approach is to immediately implement drastic cost-cutting measures without a thorough analysis, such as reducing essential staff or cutting back on patient care services. This is a reactive and potentially harmful strategy that could negatively impact patient care quality and staff morale, violating the ethical duty to provide competent care and maintain a functional practice environment. A third incorrect approach is to focus solely on increasing patient volume without considering the payer mix implications. While volume is important, if the new patients are primarily from lower reimbursement sources, this could exacerbate the financial strain rather than alleviate it. This demonstrates a lack of strategic financial planning and a failure to understand the nuances of healthcare economics. Professional reasoning. Professionals in this situation should employ a systematic decision-making process. First, gather and analyze all relevant data regarding the current and projected payer mix and its financial impact. Second, identify potential risks and opportunities associated with the observed shift. Third, develop a range of strategic options, evaluating each for its financial feasibility, ethical implications, and impact on patient care. Fourth, consult with relevant stakeholders, including physicians, administrative staff, and potentially financial advisors. Finally, implement the chosen strategy with clear communication and ongoing monitoring of its effectiveness. This process ensures that decisions are informed, ethical, and aligned with the long-term sustainability and mission of the practice. Question 3. Quality control measures reveal a consistent pattern where claims submitted for a specific complex procedure are being reimbursed at a lower rate than anticipated, suggesting a potential coding mismatch between the documented service and the billed code. The practice manager needs to address this discrepancy to ensure appropriate revenue capture while maintaining compliance. Option A. Advise the billing staff to ignore the reimbursement discrepancy for this procedure and focus on other claims, assuming the payer's reimbursement is final. Option B. Initiate a detailed review of the physician's documentation for the affected procedures, cross-referencing it with the CPT and ICD-10-CM codes used, and consult with the physician to ensure the codes accurately reflect the complexity and medical necessity of the services provided. Option C. Immediately resubmit the claims with a higher-paying CPT code that appears to better align with the perceived value of the service, assuming the initial coding was an oversight. Option D. Process a write-off for the difference between the anticipated and actual reimbursement for these claims without investigating the underlying cause of the discrepancy. The correct answer is B. Initiate a detailed review of the physician's documentation for the affected procedures, cross-referencing it with the CPT and ICD-10-CM codes used, and consult with the physician to ensure the codes accurately reflect the complexity and medical necessity of the services provided. Explanation. Scenario analysis. This scenario presents a common challenge in revenue cycle management, where a discrepancy in coding impacts reimbursement. The professional challenge lies in balancing the need for accurate financial reporting and timely payment with the ethical obligation to ensure services are billed appropriately according to established coding guidelines and payer contracts. Misrepresenting services, even unintentionally, can lead to audits, recoupments, and reputational damage. The practice manager must navigate this situation with integrity and a thorough understanding of regulatory compliance. Correct approach analysis. The correct approach involves a systematic review of the patient encounter, the physician's documentation, and the assigned CPT codes. This process should involve collaboration with the physician to clarify the documentation and ensure the code accurately reflects the complexity and medical necessity of the services rendered. This aligns with the principles of accurate billing and coding, which are fundamental to compliant revenue cycle management. Adhering to payer policies and coding guidelines, such as CPT and ICD-10-CM, is paramount to avoid fraud, waste, and abuse, and to maintain a clean claims submission process. This approach prioritizes accuracy and compliance, which are essential for long-term financial health and ethical practice. Incorrect approaches analysis. One incorrect approach is to simply resubmit the claim with a higher-paying code without further investigation. This is ethically problematic as it suggests an intent to inflate reimbursement without proper justification, potentially violating anti-kickback statutes and fraud and abuse regulations. It bypasses the crucial step of verifying medical necessity and accurate documentation, which are foundational to compliant billing. Another incorrect approach is to ignore the discrepancy and proceed with the original coding. This is professionally negligent. It fails to address a potential underpayment or overpayment, impacting the practice's financial health and potentially violating payer contract terms if underpayment is significant. It also misses an opportunity to improve documentation and coding practices, leading to recurring issues. A third incorrect approach is to immediately write off the difference without understanding the root cause. While seemingly a quick fix, it fails to identify systemic issues in the coding or documentation process. This can lead to continued financial losses or compliance risks if the discrepancy is due to a pattern of errors rather than an isolated incident. It also does not address the potential for accurate reimbursement if the initial coding was indeed incorrect. Professional reasoning. When faced with a coding discrepancy that affects reimbursement, a practice manager should initiate a thorough review. This involves examining the physician's documentation, the services provided, and the assigned codes against established coding guidelines and payer policies. If clarification is needed, Direct communication with the physician is essential to ensure accurate representation of the service. The goal is to achieve accurate and compliant billing that reflects the true value of the services rendered, thereby optimizing revenue while maintaining ethical and regulatory standards. This systematic approach fosters a culture of compliance and continuous improvement within the revenue cycle. Question 4. Process analysis reveals a consistent pattern of mid-level administrative staff expressing dissatisfaction with limited opportunities for career advancement and a perceived lack of recognition for their contributions beyond their immediate job duties. This has contributed to a higher-than-average turnover rate within this demographic over the past 2 years. What is the most effective strategy for the practice manager to implement to address this situation and improve employee engagement and retention, adhering to professional best practices? Option A. Conduct a series of mandatory team-building exercises designed to foster camaraderie and improve communication, while also reminding staff of the practice's commitment to its mission and values. Option B. Initiate a review of compensation structures to ensure competitive salaries and explore the possibility of offering targeted retention bonuses to key administrative personnel who are nearing their anniversary dates. Option C. Implement a new performance review system that focuses on identifying areas for improvement and setting more rigorous performance targets for all administrative staff. Option D. Develop and implement a structured professional development program that includes cross-training opportunities, mentorship initiatives, and clear pathways for advancement within the practice, coupled with a formal recognition program that acknowledges outstanding performance and contributions. The correct answer is D. Develop and implement a structured professional development program that includes cross-training opportunities, mentorship initiatives, and clear pathways for advancement within the practice, coupled with a formal recognition program that acknowledges outstanding performance and contributions. Explanation. This scenario presents a common challenge in healthcare practice management, balancing the need for efficient operations with the critical imperative of fostering a positive and supportive work environment. The professional challenge lies in identifying and implementing strategies that genuinely enhance employee engagement and retention, rather than superficial or compliance-driven measures. Careful judgment is required to select approaches that align with the practice's values, the specific needs of its staff, and the regulatory landscape governing employment practices. The correct approach represents best professional practice because it directly addresses the root causes of disengagement and turnover by investing in staff development and recognizing their contributions. This aligns with ethical principles of fair treatment and professional growth, and implicitly supports compliance with labor laws by creating a work environment that minimizes grounds for grievances or disputes. Furthermore, focus on professional development can lead to improved patient care outcomes, a key objective for any physician practice. An incorrect approach that focuses solely on mandatory compliance training, while necessary, fails to address the underlying issues of employee morale and job satisfaction. This approach is ethically deficient as it treats employees as mere cogs in a machine rather than valued professionals, potentially leading to a perception of being undervalued. It also misses opportunities to proactively build a loyal workforce, which can indirectly lead to increased risk of regulatory scrutiny related to staffing shortages or high turnover rates. Another incorrect approach that prioritizes cost-cutting measures over employee well-being, such as reducing benefits or limiting professional development opportunities, is ethically problematic, signals a lack of commitment to staff welfare, and can foster resentment, directly impacting retention. This approach also risks violating implicit or explicit employment agreements and can lead to a decline in the quality of care, potentially attracting negative attention from regulatory bodies concerned with patient safety and practice standards. A third incorrect approach that relies on reactive measures, such as offering retention bonuses only when staff are actively leaving, is a less effective and more costly strategy. While financial incentives can play a role, they do not address the systemic issues that drive employees away. Ethically, this approach can be seen as manipulative, offering a solution only when a crisis is imminent, rather than fostering a consistently positive environment. It also fails to build long-term loyalty and can create a perception that the practice only values its employees when it's about to lose them. The professional reasoning process for similar situations should involve a holistic assessment of the practice's current employee engagement levels, identifying specific pain points through feedback mechanisms, surveys, one-on-one meetings, and then researching and evaluating strategies that promote professional growth, recognition, and a supportive culture. This should be done in conjunction with an understanding of relevant employment laws and ethical guidelines to ensure all implemented strategies are both effective and compliant. Question 5. Cost-benefit analysis shows that implementing a new performance management and evaluation system for the physician practice could significantly improve patient outcomes and operational efficiency. However, the practice manager is concerned about staff buy-in and potential regulatory hurdles. Which of the following approaches to selecting and implementing this system is most aligned with best professional practice for a certified physician practice manager? Option A. Select a system that is widely used in other industries, without significant adaptation, and communicate the new evaluation metrics to staff with minimal explanation. Option B. Rely on the personal opinions and informal feedback of senior physicians to define performance standards and conduct all evaluations without a formal, documented process. Option C. Develop a system based on clear, measurable objectives tied to organizational goals, involve key stakeholders in the design process, and provide comprehensive training and ongoing support for all staff. Option D. Implement a system that primarily focuses on identifying and penalizing underperforming individuals, using subjective observations and past grievances as primary evaluation criteria. The correct answer is C. Develop a system based on clear, measurable objectives tied to organizational goals, involve key stakeholders in the design process, and provide comprehensive training and ongoing support for all staff. Explanation. This scenario presents a common challenge in healthcare practice management, balancing the desire for improved performance with the practicalities of implementation and the potential for unintended consequences. The professional challenge lies in selecting a performance management system that is not only effective in driving desired outcomes, but also compliant with relevant regulations, ethically sound, and accepted by the physician practice staff. A poorly chosen system can lead to decreased morale, increased administrative burden, and potential legal or compliance issues. The correct approach represents best professional practice because it prioritizes a systematic, data-driven, and inclusive method for selecting and implementing a performance management system. This aligns with the principles of good governance and operational efficiency expected of a certified physician practice manager. By involving stakeholders, clearly defining objectives, and ensuring alignment with organizational goals, the practice can implement a system that is more likely to be successful and sustainable. This approach also implicitly supports compliance with any applicable regulations regarding employee evaluation and fair labor practices by ensuring transparency and a clear rationale for the system's design. An incorrect approach that focuses solely on punitive measures without a clear framework for improvement or support is ethically problematic. It can create a climate of fear and distrust, potentially leading to staff disengagement and a decline in the quality of patient care. Such an approach may also violate employment laws or regulations that mandate fair and objective performance evaluations and provide avenues for recourse. Another incorrect approach that relies on anecdotal evidence or personal bias in performance evaluation is inherently flawed and unprofessional. It lacks objectivity, can lead to discriminatory practices, and undermines the credibility of the performance management system. This approach is susceptible to legal challenges based on unfair treatment and can violate ethical standards of professional conduct. A third incorrect approach that ignores the need for training and support for staff can lead to frustration and resistance. Without understanding how performance will be measured or how to improve, staff may feel set up for failure. This can result in a system that is not utilized effectively, failing to achieve its intended benefits, and potentially creating compliance issues if performance standards are not met due to lack of proper guidance. The professional decision-making process for similar situations should involve a thorough needs assessment, research into various performance management methodologies, consultation with legal counsel and HR professionals to ensure regulatory compliance, and engagement with staff to foster buy-in and address concerns. A phased implementation with pilot testing and ongoing evaluation is also advisable. Question 6. The assessment process reveals that a physician practice is experiencing high turnover in its administrative support staff. To address this, the practice manager is considering streamlining the recruitment process by relying heavily on informal referrals from current employees and conducting brief, unstructured interviews that focus on a candidate's perceived fit with the existing team culture. Which of the following approaches best aligns with regulatory requirements and ethical best practices for recruitment in a U.S.-based healthcare setting? Option A. Focus interview questions on a candidate's personal life and family situation to gauge their commitment to the job and their ability to handle stress, as this provides insight into their overall character. Option B. Rely primarily on online professional networking profiles and social media to vet candidates, as this offers a comprehensive view of their personality and professional background without the need for formal interviews or reference checks. Option C. Implement a standardized interview process with job-related questions, conduct thorough reference checks, and ensure all hiring decisions are based on objective qualifications and experience, while adhering to all federal and state anti-discrimination laws. Option D. Prioritize candidates who are referred by current employees, as they are more likely to be a good cultural fit and require less training, and conduct short, informal interviews to quickly assess personality. The correct answer is C. Implement a standardized interview process with job-related questions, conduct thorough reference checks, and ensure all hiring decisions are based on objective qualifications and experience, while adhering to all federal and state anti-discrimination laws. Explanation. The assessment process reveals a common challenge in healthcare recruitment, balancing the need for efficient hiring with the imperative to ensure compliance with all applicable regulations and ethical standards. In the U.S. healthcare context, specifically for a certified physician practice manager, CPPM, this involves navigating federal and state laws related to employment, anti-discrimination, and patient privacy, as well as professional ethical guidelines. The scenario is professionally challenging because a misstep in recruitment can lead to legal repercussions, damage to the practice's reputation, and ultimately compromise the quality of patient care by hiring unqualified individuals or creating a discriminatory environment. The correct approach represents best professional practice because it prioritizes a structured, legally compliant, and ethically sound recruitment process. This involves clearly defining job requirements, utilizing objective assessment methods, ensuring all candidates are evaluated fairly without bias, and conducting thorough background checks that adhere to privacy regulations like HIPAA. This systematic approach minimizes risk, promotes diversity and inclusion, and helps secure candidates who are not only skilled, but also aligned with the practice's values and legal obligations. An incorrect approach that relies on informal networking or personal recommendations without formal vetting fails to meet regulatory requirements. This can lead to the hiring of individuals who may not possess the necessary qualifications or who may pose a risk to patient privacy or safety, violating principles of due diligence and potentially leading to negligent hiring claims. Another incorrect approach that involves asking interview questions that probe into protected characteristics, e.g., marital status, age, religion, directly violates anti-discrimination laws such as Title Roman VII of the Civil Rights Act of 1964 and the Americans with Disabilities Act, ADA. Such questions can create a perception of bias, even if unintentional, and can lead to legal challenges and reputational damage. An approach that bypasses reference checks entirely or conducts them superficially neglects a crucial step in verifying a candidate's past performance and suitability, potentially overlooking red flags that could impact patient care or practice operations. Professional decision-making in recruitment should involve a framework that begins with a clear understanding of the role's requirements and the legal landscape. This includes developing standardized interview questions, utilizing skills-based assessments, ensuring interview panels are trained on EEO principles, and establishing a consistent process for reference checks and background screening. The focus should always be on a candidate's ability to perform the job duties and their adherence to professional and ethical standards, while strictly avoiding any inquiries or practices that could be construed as discriminatory or a violation of privacy. Question 7. The efficiency study reveals a concerning trend of declining net patient revenue alongside a simultaneous increase in overall operating expenses over the past 2 fiscal quarters. As the certified physician practice manager, what is the most appropriate initial course of action to address these financial indicators? Option A. Immediately implement a hiring freeze and reduce discretionary spending across all departments to curb rising costs. Option B. Acknowledge the fluctuations as normal business cycles and defer any significant action until the next annual budget review. Option C. Focus marketing efforts on increasing patient volume to compensate for the decrease in revenue per patient. Option D. Conduct a detailed analysis of the revenue cycle management process and scrutinize individual expense categories to identify specific drivers of these trends. The correct answer is D. Conduct a detailed analysis of the revenue cycle management process and scrutinize individual expense categories to identify specific drivers of these trends. Explanation. Scenario analysis. The efficiency study revealing a decline in net patient revenue and an increase in operating expenses presents a common yet challenging scenario for a certified physician practice manager, CPPM. The challenge lies in interpreting these financial statements beyond surface-level numbers to understand the underlying causes and their implications for the practice's sustainability and compliance. A CPPM must balance financial stewardship with patient care quality and regulatory adherence. Misinterpreting these trends can lead to poor strategic decisions, impacting staff morale, patient access, and the practice's long-term viability. Correct approach analysis. The correct approach involves a comprehensive review of the financial statements, specifically focusing on the trends in net patient revenue and operating expenses. This includes analyzing the revenue cycle management to identify potential issues with billing, coding, or collections that might be contributing to the revenue decline. Simultaneously, a detailed examination of expense categories is crucial to pinpoint areas of significant increase, such as staffing costs, supplies, or overhead. This analytical approach aligns with the CPPM responsibility to ensure the financial health of the practice, which is a core tenet of effective practice management, and implicitly supported by regulatory frameworks that require sound financial operations for continued licensure and accreditation. It demonstrates a commitment to data-driven decision-making and proactive problem-solving, essential for maintaining compliance with financial reporting standards and operational efficiency guidelines. Incorrect approaches analysis. One incorrect approach would be to immediately implement across-the-board cost-cutting measures without a thorough analysis. This is professionally unacceptable because it fails to identify the root causes of the expense increase and could negatively impact patient care quality or essential operational functions. Such an approach disregards the need for targeted interventions and could lead to inefficiencies elsewhere, potentially violating ethical obligations to provide quality care and manage resources responsibly. Another incorrect approach would be to focus solely on increasing patient volume to offset the revenue decline, without investigating why net revenue per patient might be decreasing. This is a failure in professional judgment as it ignores potential issues within the revenue cycle, such as undercoding, claim denials, or inadequate fee schedules, which are critical components of financial management. It also risks overwhelming existing resources and potentially compromising patient care, which is a direct ethical and professional failing. A third incorrect approach would be to dismiss the findings as mere fluctuations and take no action. This is a significant regulatory and ethical failure. Ignoring declining revenue and rising expenses jeopardizes the financial stability of the practice, potentially leading to noncompliance with financial obligations, inability to meet payroll, or failure to invest in necessary equipment or staff training. This inaction directly contravenes the CPPM duty of care and fiduciary responsibility to the practice. Professional reasoning. Professionals should employ a structured decision-making framework when faced with financial statement analysis. This framework typically involves 1. Data gathering and verification. Ensure the accuracy and completeness of the financial data. 2. Trend analysis. Identify significant changes and patterns over time. 3. Root cause analysis. Investigate the underlying reasons for observed trends. 4. Impact assessment. Evaluate the potential consequences of these trends on operations, patient care, and compliance. 5. Strategy development. Formulate targeted and evidence-based solutions. 6. Implementation and monitoring. Execute the chosen strategies and continuously track their effectiveness. This systematic approach ensures that decisions are informed, ethical, and aligned with regulatory requirements and professional best practices. Question 8. System analysis indicates a physician practice is experiencing challenges in fostering a truly inclusive environment, with some employee groups reporting feelings of marginalization. The practice manager is tasked with developing new initiatives to address this, Which of the following approaches best aligns with regulatory frameworks and ethical best practices for promoting diversity and inclusion in a U.S.-based healthcare setting? Option A. Implement a comprehensive diversity and inclusion strategy developed through extensive consultation with employee resource groups, department heads, and individual staff members across all levels and demographics, focusing on education, equitable policy review, and inclusive communication channels. Option B. Establish specific numerical targets for representation of underrepresented groups in leadership positions, with a focus on achieving these quotas within the next fiscal year through targeted hiring and promotion efforts. Option C. Revise the employee handbook to include a general statement on diversity and inclusion, and delegate the responsibility for addressing any specific inclusion concerns to individual department managers, without providing them with additional resources or guidance. Option D. Introduce mandatory unconscious bias training for all staff, with the expectation that this single intervention will resolve all issues related to workplace inclusion and equity. The correct answer is A. Implement a comprehensive diversity and inclusion strategy developed through extensive consultation with employee resource groups, department heads, and individual staff members across all levels and demographics, focusing on education, equitable policy review, and inclusive communication channels. Explanation. This scenario presents a professional challenge due to the inherent tension between fostering a diverse and inclusive workplace and the practical realities of implementing policies that may be perceived differently by various employee groups. Careful judgment is required to ensure that initiatives aimed at promoting diversity and inclusion are equitable, effective, and compliant with relevant regulations, without creating unintended negative consequences or alienating any segment of the workforce. The goal is to create an environment where all individuals feel valued, respected, and have equal opportunities for growth and contribution. The correct approach represents best professional practice because it directly addresses the core principles of diversity and inclusion by seeking input from all employee groups. This collaborative method ensures that policies are not only compliant with the spirit of equal opportunity, but also practically implementable and culturally sensitive. It aligns with the ethical imperative to treat all employees fairly and with respect, fostering a sense of belonging and psychological safety. Furthermore, by involving employees in the policy development, it increases buy-in and reduces the likelihood of resistance or misinterpretation, thereby promoting a more harmonious and productive work environment. This proactive and inclusive strategy is crucial for mitigating potential legal risks associated with discriminatory practices and for building a strong organizational culture. An incorrect approach that focuses solely on demographic targets without considering the lived experiences and perspectives of all employees risks creating a perception of tokenism or reverse discrimination. This can lead to resentment among staff and may not effectively address the underlying issues contributing to a lack of inclusion. Ethically, it fails to uphold the principle of treating individuals based on merit and contribution, potentially leading to claims of unfair treatment. Legally, while aiming for diversity is often a positive goal, rigid, quota-based systems can sometimes be challenged if not carefully implemented within legal frameworks designed to prevent discrimination. Another incorrect approach that relies on a top-down mandate without employee consultation can lead to policies that are out of touch with the daily realities of the workforce. This can result in ineffective or even counterproductive initiatives that fail to achieve genuine inclusion. Professionally, it demonstrates a lack of understanding of organizational dynamics and employee engagement. Ethically, it neglects the responsibility to foster a workplace where all voices are heard and considered. Regulatory failures could arise if such policies inadvertently create barriers for certain groups or fail to address existing systemic issues, potentially leading to complaints of discrimination or a hostile work environment. The professional reasoning process for such situations should involve a comprehensive assessment of the current workplace climate, identification of specific diversity and inclusion challenges, and a commitment to developing solutions collaboratively. This includes understanding relevant federal and state anti-discrimination laws and guidelines, such as those enforced by the Equal Employment Opportunity Commission, EOC, in the United States, which prohibit discrimination based on race, color, religion, sex, national origin, age, disability, or genetic information. Professionals should prioritize open communication, actively solicit feedback from all employee levels and demographics, and ensure that any implemented strategies are data-informed, equitable, and consistently applied. The decision-making framework should be iterative, allowing for adjustments based on ongoing feedback and evaluation to ensure that diversity and inclusion efforts are sustainable and genuinely beneficial to the entire organization. Question 9. Operational review demonstrates that the practice's current budgeting process is heavily reliant on historical spending patterns from the previous fiscal year, with minimal input from clinical staff and limited consideration for anticipated changes in payer reimbursement rates or upcoming regulatory compliance mandates. Which of the following approaches best aligns with best practices for budgeting processes in a U.S.-based physician practice, ensuring both financial health and regulatory adherence? Option A. Implement a zero-based budgeting approach that requires all expenses to be justified from scratch each budget cycle, involving extensive input from physicians and department heads to align spending with strategic goals and current regulatory requirements. Option B. Develop the budget based on the projections of the Chief Financial Officer, assuming current reimbursement rates will remain stable and that no new significant regulatory changes will impact operations in the upcoming year. Option C. Focus solely on maximizing revenue by increasing patient volume through aggressive marketing, with budget allocations primarily driven by projected income rather than detailed expense analysis or compliance needs. Option D. Continue using historical data as the primary basis for the budget, with minor adjustments for inflation, and delegate the responsibility for ensuring regulatory compliance to the billing department alone. The correct answer is A. Implement a zero-based budgeting approach that requires all expenses to be justified from scratch each budget cycle, involving extensive input from physicians and department heads to align spending with strategic goals and current regulatory requirements. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare budgeting, balancing the need for robust financial planning with the dynamic and often unpredictable nature of patient care and regulatory changes. A practice manager must navigate competing priorities, ensuring financial sustainability while maintaining high-quality patient services and compliance with all applicable regulations. The challenge lies in developing a budget that is both realistic and adaptable, avoiding overly rigid assumptions that could hinder operations or lead to non-compliance. Correct approach analysis. The correct approach emphasizes a collaborative and data-driven budgeting process that aligns with strategic organizational goals and regulatory requirements. In the U.S. healthcare context, this involves engaging key stakeholders, including physicians, administrative staff, and finance personnel, to gather input and ensure buy-in. It also necessitates a thorough understanding of current and projected revenue streams, operating expenses, and anticipated changes in payer mix and reimbursement rates, all within the framework of relevant federal and state healthcare laws, e.g., HIPAA for data privacy, Stark Law and Anti-Kickback Statute for physician referrals, and Medicare/Medicaid regulations for billing and coding. This approach promotes transparency, accuracy, and compliance, leading to a more effective and sustainable budget. Incorrect approach is analysis. An approach that relies solely on historical data without considering future trends or regulatory shifts is flawed, because it fails to account for evolving healthcare landscapes, such as new payment models or changes in compliance requirements. This can lead to inaccurate projections and potential financial shortfalls or overspending, and may inadvertently lead to non-compliance if new regulations are not factored into resource allocation. An approach that prioritizes cost-cutting above all else, without considering the impact on patient care quality or staff morale, is problematic. While fiscal responsibility is crucial, compromising patient outcomes or essential services can lead to decreased patient satisfaction, potential malpractice claims, and ultimately, reduced revenue. Furthermore, understaffing or inadequate resources due to aggressive cost-cutting can create an environment where regulatory compliance is harder to maintain. An approach that delegates the entire budgeting process to a single department without input from clinical or operational staff is likely to result in a budget that is disconnected from the realities of daily practice. This can lead to unrealistic targets, operational inefficiencies, and a lack of accountability, potentially creating situations where compliance with specific healthcare regulations becomes difficult to enforce due to a lack of understanding or resources at the operational level. Professional reasoning. Professionals should adopt a systematic and inclusive budgeting process. This involves 1. Understanding the organization's strategic objectives and regulatory obligations. 2. Gathering input from all relevant departments and stakeholders. 3. Utilizing a combination of historical data, market analysis, and forward-looking projections. 4. Regularly reviewing and adjusting the budget based on performance and changing circumstances. 5. Ensuring that all budget allocations support compliance with applicable healthcare laws and ethical standards. Question 10. Cost-benefit analysis shows that outsourcing medical transcription services could significantly reduce operational expenses for the physician practice. However, the practice manager is aware that patient health information will be shared with a third-party vendor. What is the most appropriate regulatory and legal framework consideration for this decision? Option A. Proceeding with the outsourcing if the cost savings are substantial, assuming regulatory scrutiny will be minimal for transcription services. Option B. Implementing the change immediately to capture cost savings and addressing any potential compliance issues if they arise later. Option C. Relying on the vendor's stated commitment to data privacy as sufficient assurance of compliance. Option D. Ensuring the third-party vendor has a robust business associate agreement in place that clearly outlines HIPAA compliance obligations and data security protocols. The correct answer is D. Ensuring the third-party vendor has a robust business associate agreement in place that clearly outlines HIPAA compliance obligations and data security protocols. Explanation. This scenario is professionally challenging because it requires a physician practice manager to balance operational efficiency and cost savings with stringent regulatory compliance and patient safety. The core conflict lies in the potential for a cost-saving measure to inadvertently create a compliance risk. Careful judgment is required to ensure that any proposed change does not violate the Health Insurance Portability and Accountability Act, HIPAA, or other relevant federal healthcare regulations. The correct approach represents best professional practice because it prioritizes a thorough understanding of the regulatory landscape before implementing any changes. This proactive stance ensures that patient data privacy and security, as mandated by HIPAA, are not compromised. By consulting with legal counsel and compliance officers, the practice manager demonstrates due diligence and a commitment to ethical operations, thereby mitigating potential legal and financial repercussions. This aligns with the CPPM responsibility to manage a practice in accordance with all applicable laws and regulations. An incorrect approach that focuses solely on cost reduction without considering regulatory implications is professionally unacceptable. This failure to account for HIPAA privacy and security rules could lead to significant penalties, including fines and reputational damage. Another incorrect approach that involves implementing the change without seeking expert advice ignores the complexity of healthcare regulations and the potential for unintended consequences. This demonstrates a lack of professional responsibility and a disregard for established compliance protocols. A third incorrect approach that relies on anecdotal evidence or industry trends without specific regulatory review is also flawed, as it fails to address the unique legal obligations of the practice. Professionals should employ a decision-making framework that begins with identifying potential regulatory impacts of any proposed operational change. This should be followed by consulting relevant legal and compliance experts to assess risks and ensure adherence to all applicable laws and guidelines. Finally, a comprehensive risk assessment should inform the decision, prioritizing patient safety and regulatory compliance over short-term cost savings. Question 11. The monitoring system demonstrates a consistent backlog in appointment scheduling and a higher-than-average rate of denied insurance claims related to incomplete patient registration information. The practice manager is tasked with improving these metrics. Which of the following approaches is the most appropriate for addressing these workflow challenges? Option A. Focus solely on increasing front desk staffing levels to clear the scheduling backlog and instruct the billing team to manually re-verify all insurance information for every patient. Option B. Initiate a comprehensive root cause analysis of both the scheduling backlog and claim denial trends, involving key staff from front desk operations and billing departments, followed by a pilot program for any proposed process changes. Option C. Immediately implement a new, more complex scheduling software system to address the backlog and mandate additional training for all staff on insurance verification procedures to reduce claim denials. Option D. Delegate the task of identifying solutions to the front desk and billing staff without providing specific guidance or a structured analytical framework, expecting them to resolve the issues independently. The correct answer is B. Initiate a comprehensive root cause analysis of both the scheduling backlog and claim denial trends, involving key staff from front desk operations and billing departments, followed by a pilot program for any proposed process changes. Explanation. This scenario presents a common implementation challenge in workflow analysis and process improvement within a physician practice. The core difficulty lies in balancing the need for efficiency and improved patient care with the practical realities of staff adoption, potential resistance to change, and the imperative to maintain compliance with all applicable regulations. A physician practice manager must navigate these complexities by focusing on data-driven insights, stakeholder engagement, and a phased, compliant implementation strategy. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and compliant method for addressing identified inefficiencies. By first conducting a detailed root cause analysis, the practice manager ensures that proposed solutions are targeted and effective, rather than merely addressing symptoms. Engaging frontline staff in the redesign process fosters buy-in and leverages their practical knowledge, leading to more sustainable improvements. Furthermore, piloting changes before full rollout minimizes disruption and allows for iterative refinement, ensuring that the final processes are both efficient and compliant with all relevant healthcare regulations, such as those governing patient privacy, e.g., HIPAA in the U.S., and billing integrity. This methodical approach minimizes risk and maximizes the likelihood of successful, long-term process enhancement. An incorrect approach that focuses solely on immediate cost reduction without understanding the underlying workflow issues is professionally unacceptable. This could lead to superficial changes that fail to address the root causes of inefficiency, potentially creating new problems or even violating regulations if, for example, cost-cutting measures compromise patient safety or data security. Another incorrect approach that bypasses staff input and imposes changes unilaterally is ethically problematic and likely to result in resistance, decreased morale, and ultimately, a failure to achieve the desired improvements. This disregard for the human element of process change can also lead to unintentional compliance breaches if staff, feeling disempowered, make errors in following new, poorly understood procedures. A third incorrect approach that prioritizes speed over thoroughness risks implementing solutions that are not fully vetted, potentially leading to compliance violations or further operational disruptions. This haste can overlook critical regulatory requirements or create new bottlenecks. Professional decision-making in such situations requires a structured approach. 1. Define the problem clearly using objective data. 2. Engage all relevant stakeholders, especially those directly impacted by the workflow. 3. Analyze the root causes of inefficiencies, not just the symptoms. 4. Develop potential solutions collaboratively, considering regulatory and ethical implications. 5. Pilot test solutions to assess effectiveness and identify unforeseen issues. 6. Implement changes systematically with adequate training and support. 7. Continuously monitor and evaluate the impact of the changes. Question 12. Process analysis reveals that a physician practice is experiencing a decline in patient retention and an increase in negative online reviews, prompting a review of patient satisfaction and experience measurement strategies. Which of the following approaches best aligns with regulatory requirements and professional best practices for assessing and improving patient satisfaction? Option A. Focusing solely on the number of positive online reviews as the primary indicator of patient satisfaction, with no other systematic feedback mechanisms in place. Option B. Implementing a comprehensive patient feedback system that includes post-visit surveys, analysis of formal complaints and compliments, and monitoring of online review platforms, ensuring all data collection and handling adhere strictly to HIPAA privacy and security rules. Option C. Relying primarily on informal conversations between clinical staff and patients to gauge satisfaction, assuming that direct interaction is the most accurate measure of patient experience. Option D. Conducting anonymous patient surveys that do not collect any demographic or contact information, but without a clear plan for how the aggregated data will be analyzed or used for practice improvement. The correct answer is B. Implementing a comprehensive patient feedback system that includes post-visit surveys, analysis of formal complaints and compliments, and monitoring of online review platforms, ensuring all data collection and handling adheres strictly to HIPAA privacy and security rules. Explanation: this scenario presents a common challenge in healthcare management, balancing the diverse needs and expectations of various stakeholders while ensuring compliance with regulatory frameworks governing patient care and practice operations. The Certified Physician Practice Manager, CPPM, must navigate these complexities to foster a positive patient experience, which directly impacts practice reputation, patient retention, and ultimately, financial viability. The challenge lies in identifying and implementing measurement strategies that are both effective in capturing genuine patient sentiment and compliant with relevant regulations, such as those pertaining to data privacy and patient rights. The correct approach prioritizes a multifaceted strategy that incorporates both direct patient feedback mechanisms and indirect indicators of satisfaction, all while adhering to the Health Insurance Portability and Accountability Act, HIPAA, and relevant state medical board guidelines. This approach is best professional practice because it provides a comprehensive understanding of the patient journey, allowing for targeted improvements. Utilizing standardized surveys, like HCOPs or custom-validated instruments, analyzing patient complaints and compliments, and monitoring online reviews offer a balanced perspective. Furthermore, ensuring all data collection and analysis methods are HIPAA compliant, particularly concerning protected health information, FI, is a non-negotiable ethical and legal requirement. This holistic view allows for data-driven decision-making that enhances patient care and operational efficiency. An incorrect approach would be to solely rely on informal feedback or anecdotal evidence. This fails to provide quantifiable data for meaningful analysis and improvement, and it risks overlooking systemic issues. Ethically, it neglects the responsibility to systematically gather and act upon patient feedback. Another incorrect approach is to implement surveys without considering data privacy regulations. Collecting patient contact information or survey responses without proper consent or secure storage violates HIPAA, leading to significant legal penalties and reputational damage. Focusing exclusively on online reviews, while valuable, is insufficient as it represents only a segment of the patient population and can be subject to manipulation. This approach neglects the broader patient experience and fails to capture feedback from those who may not actively participate in online forums. Professionals should approach this situation by first identifying all relevant stakeholders and their perspectives on patient satisfaction. Next, they must research and select measurement tools and methodologies that are validated, reliable, and compliant with all applicable regulations, particularly HIPAA. A robust process involves establishing clear objectives for patient satisfaction measurement, implementing data collection, analyzing the findings, and developing actionable improvement plans. Regular review and adaptation of these strategies are crucial to maintain effectiveness and compliance in a dynamic healthcare environment. Question 13. Assessment of the most appropriate initial response by a Certified Physician Practice Manager, CPPM, when a pattern of near-miss events related to medication administration errors is identified through internal reporting, impacting patient safety. Option A. Instruct all nursing staff to be more vigilant and double-check all medications, relying on individual diligence to resolve the issue. Option B. Immediately revise the practice's medication administration policy to include stricter protocols for all staff, without further investigation, to prevent future occurrences. Option C. Initiate a comprehensive root cause analysis (RCA) to identify systemic factors contributing to the medication administration errors, while simultaneously implementing immediate, temporary procedural safeguards to mitigate further risk. Option D. Document the near misses in a logbook and schedule a discussion about the issue at the next quarterly practice meeting to address it when time permits. The correct answer is C. Initiate a comprehensive root cause analysis (RCA) to identify systemic factors contributing to the medication administration errors, while simultaneously implementing immediate, temporary procedural safeguards to mitigate further risk. Explanation: scenario analysis. This scenario presents a common challenge in healthcare management, balancing the need for immediate patient care with the imperative to implement systemic quality improvements. The physician practice manager must navigate competing demands, limited resources, and the potential for resistance to change. The challenge lies in identifying the most impactful and compliant approach to address a critical safety concern without disrupting essential services or violating regulatory mandates. Careful judgment is required to prioritize actions that are both effective and ethically sound, ensuring patient well-being and adherence to established standards. Correct approach analysis. The correct approach prioritizes a structured, data-driven, and compliant method for addressing a patient safety issue. This involves immediate containment of the risk, followed by a thorough root cause analysis, RCA, to understand the underlying systemic failures. Implementing corrective actions based on the RCA and then monitoring their effectiveness aligns with the principles of continuous quality improvement mandated by regulatory bodies. This systematic process ensures that the identified problem is not only addressed in the short term, but also prevented from recurring, thereby enhancing overall patient safety and practice efficiency. This approach is directly supported by the principles of quality management and patient safety frameworks often emphasized in healthcare regulations, such as those guiding the Certified Physician Practice Manager (CPPM) certification, which stress proactive risk management and evidence-based practice. Incorrect approaches analysis. One incorrect approach involves solely relying on anecdotal evidence or individual staff reports to implement changes. This lacks the rigor required for effective quality improvement and may lead to superficial fixes that do not address the root cause. It can also lead to inconsistent application of protocols and potential noncompliance with regulatory requirements for documented quality initiatives. Another incorrect approach is to implement a broad, sweeping policy change without a thorough investigation or understanding of the specific contributing factors. This can be disruptive, costly, and may not effectively resolve the identified safety concern. It also bypasses the critical step of root cause analysis, which is fundamental to sustainable quality improvement and often a requirement for regulatory compliance. A third incorrect approach is to defer action indefinitely due to perceived resource constraints or the complexity of the issue. This directly compromises patient safety and can lead to significant regulatory penalties and reputational damage. Healthcare regulations emphasize a proactive and timely response to identified risks, and inaction is a failure to meet these obligations. Professional reasoning. Professionals should employ a decision-making framework that begins with immediate risk assessment and mitigation. This is followed by a systematic investigation, often utilizing a root cause analysis methodology to identify systemic issues. Based on the findings, evidence-based corrective actions are developed and implemented. Crucially, a robust monitoring and evaluation plan must be established to ensure the effectiveness of the implemented changes and to identify any new issues. This iterative process of Plan-Do-Check-Act (PDCA) or similar quality improvement cycles is essential for maintaining high standards of patient care and regulatory compliance. Question 14. Comparative studies suggest that the implementation of new federal healthcare reimbursement policies can significantly alter practice revenue streams and operational demands. As a certified physician practice manager, CPPM, overseeing a multi-specialty clinic, what is the most prudent approach to proactively manage the potential impact of such policy shifts on the practice's financial stability and patient service delivery? Option A. Delay any significant practice adjustments until the policy has been in effect for at least 6 months, allowing for observation of its real-world effects on other practices. Option B. Immediately adjust billing codes and fee schedules across all services to preemptively capture any potential revenue increases indicated by the new policy. Option C. Focus solely on ensuring the practice's billing department is updated with the new coding requirements, assuming other operational areas will adapt organically. Option D. Conduct a thorough risk assessment to identify potential financial, operational, and patient care impacts, developing a strategic plan for adaptation and mitigation. The correct answer is D. Conduct a thorough risk assessment to identify potential financial, operational, and patient care impacts, developing a strategic plan for adaptation and mitigation. Explanation. The scenario presents a common challenge in healthcare practice management, adapting to evolving healthcare policies and understanding their downstream effects on operational efficiency and financial viability. Physician practice manager must proactively assess the potential impact of new regulations to ensure compliance, maintain patient care quality, and safeguard the practice's financial health. This requires a strategic approach that goes beyond mere awareness of policy changes. The correct approach involves a comprehensive risk assessment that identifies potential operational disruptions, financial implications, and necessary adjustments to workflows, staffing, and technology. This proactive stance allows the practice to mitigate negative consequences, capitalize on opportunities presented by the policy, and ensure continued compliance. It aligns with the ethical responsibility of a practice manager to protect the practice and its patients from adverse effects of regulatory changes, and upholds the principles of sound business management within the healthcare sector. Incorrect approaches fail to adequately address the multifaceted impact of healthcare policies. Focusing solely on immediate compliance without considering broader operational or financial consequences can lead to unforeseen problems and reactive, inefficient problem solving. Ignoring potential financial impacts can jeopardize the practice's sustainability. Conversely, overreacting or implementing drastic changes without a thorough assessment can be costly and disruptive. These approaches demonstrate a lack of strategic foresight and can result in noncompliance, financial strain, or compromised patient care, all of which are professionally unacceptable. Professional decision-making in such situations requires a systematic process. First, thoroughly understand the new policy and its direct requirements. Second, conduct a detailed impact analysis across all practice functions: clinical, administrative, financial, IT. Third, identify specific risks and opportunities. Fourth, develop a mitigation and implementation plan with clear timelines and responsibilities. Finally, monitor the effectiveness of the implemented changes and adjust as needed. This structured approach ensures that decisions are informed, evidence-based, and aligned with the practice's overall goals and regulatory obligations. Question 15. The performance metrics show a sustained increase in patient wait times within the cardiology department, leading to a decline in patient satisfaction scores. As the certified physician practice manager, which of the following approaches best aligns with accreditation standards for process optimization and patient-centered care? Option A. Initiate a comprehensive review of patient scheduling protocols, staffing levels, and physician availability to identify bottlenecks, followed by the implementation of data-driven process improvements in collaboration with department staff. Option B. Implement immediate cost-saving measures by reducing administrative support staff in the cardiology department to offset potential revenue losses from lower patient satisfaction. Option C. Focus on increasing physician productivity by implementing stricter time management guidelines for patient encounters, without investigating the underlying causes of the wait times. Option D. Communicate the declining patient satisfaction scores to the cardiology department physicians and staff, emphasizing the need for them to manage their time more efficiently. The correct answer is A. Initiate a comprehensive review of patient scheduling protocols, staffing levels, and physician availability to identify bottlenecks, followed by the implementation of data-driven process improvements in collaboration with department staff. Explanation: the performance metrics show a consistent decline in patient satisfaction scores related to wait times in the cardiology department. This scenario is professionally challenging because it directly impacts patient experience, potentially affects reimbursement rates tied to patient satisfaction, and could indicate systemic inefficiencies that may not align with accreditation standards, such as those set by the Joint Commission, which emphasize patient-centered care and operational efficiency. A physician practice manager must balance operational demands with patient well-being and regulatory compliance. The correct approach involves a systematic, data-driven investigation into the root causes of the increased wait times. This includes analyzing patient flow, staffing levels, appointment scheduling protocols, and physician availability. Collaborating with department staff, physicians, and potentially patients to gather feedback and identify bottlenecks is crucial. Implementing evidence-based process improvements, such as optimizing scheduling templates, exploring telehealth options for follow-up appointments, or reallocating resources, directly addresses the performance metric and aligns with accreditation standards that require continuous quality improvement and efficient patient care delivery. This proactive and collaborative approach demonstrates a commitment to patient satisfaction and operational excellence, which are core tenets of accreditation. An incorrect approach that focuses solely on increasing physician productivity without addressing underlying systemic issues is professionally unacceptable. This fails to acknowledge that wait times are often a symptom of broader operational challenges, not just physician output. Such an approach could lead to physician burnout, decreased quality of care, and ultimately, a worsening of patient satisfaction, directly contravening accreditation standards that promote a safe and effective care environment. Another incorrect approach that involves simply communicating the metrics to the department without proposing or implementing solutions is also professionally deficient. This abdicates the manager's responsibility to lead and facilitate improvement. Accreditation standards expect proactive management and demonstrable efforts to address performance issues. Ignoring the problem or passing it back to the department without support or a plan is a failure to meet these expectations and a dereliction of managerial duty. Finally, an approach that prioritizes cost-cutting measures, such as reducing staffing or support personnel, without a thorough analysis of their impact on patient flow and wait times, is also problematic. While financial stewardship is important, it must be balanced with patient care quality. Such measures, if implemented without careful consideration, could exacerbate wait times and negatively impact patient satisfaction, leading to non-compliance with accreditation requirements for efficient and effective care delivery. The professional decision-making process for similar situations should involve 1. Data analysis. Thoroughly review performance metrics to identify trends and potential problem areas. 2. Root cause analysis. Investigate the underlying reasons for the observed performance. 3. Stakeholder collaboration. Engage relevant staff, physicians, and patients in the problem-solving process. 4. Solution development. Brainstorm and evaluate potential solutions based on evidence and best practices. 5. Implementation and monitoring. Execute chosen solutions and continuously track their effectiveness, making adjustments as needed. 6. Documentation. Maintain records of the process, interventions, and outcomes to demonstrate compliance and continuous improvement. Question 16. To address the challenge of integrating new patient scheduling and electronic health record (EHR) software to improve practice efficiency and patient engagement, a certified physician practice manager (CPPM) must navigate the complex landscape of U.S. healthcare regulations, particularly concerning patient data privacy and security. The practice has identified several promising software solutions, but the decision-making process requires careful consideration of compliance and risk. Which of the following approaches best aligns with regulatory requirements and professional best practices for technology integration in a physician practice? Option A. Prioritize the software with the most advanced features and user-friendly interface, assuming that reputable vendors adhere to all relevant privacy and security laws, and proceed with implementation after a brief review of the vendor's privacy policy. Option B. Select the software solution that offers the lowest upfront cost and subscription fees, as cost-effectiveness is a primary driver for practice management decisions, and assume that any necessary compliance measures can be addressed post-implementation. Option C. Rely on the recommendations of other physician practices and industry publications to identify a suitable software and proceed with implementation based on these external endorsements without extensive internal review of specific security features or contractual terms. Option D. Conduct a comprehensive risk assessment of each potential software solution, involving legal counsel and IT security specialists to evaluate data security protocols, vendor business associate agreements, BA, and compliance with HIPAA security and privacy rules before making a selection and implementing a phased rollout with thorough staff training. The correct answer is A. Prioritize the software with the most advanced features and user-friendly interface, assuming that reputable vendors adhere to all relevant privacy and security laws, and proceed with implementation after a brief review of the vendor's privacy policy. Explanation. This scenario presents a common challenge in modern medical practice, balancing the drive for technological advancement with the imperative of patient privacy and data security, all within the strict confines of U.S. healthcare regulations, particularly HIPAA. The professional challenge lies in identifying and implementing technology that enhances efficiency and patient care without compromising the confidentiality, integrity, and availability of protected health information. 5. Careful judgment is required to navigate the complexities of data governance, vendor vetting, and staff training. The correct approach represents best professional practice because it prioritizes a comprehensive risk assessment and adherence to regulatory mandates. By involving legal counsel and IT security specialists, The practice manager ensures that any new technology is evaluated not only for its functional benefits, but also for its compliance with HIPAA security rule and privacy rule. This proactive stance minimizes the risk of data breaches, unauthorized access, and subsequent penalties. Furthermore, a phased implementation with thorough staff training addresses the human element, which is often the weakest link in security protocols, thereby fostering a culture of compliance and responsible technology use. An incorrect approach that focuses solely on cost savings without a thorough security review is professionally unacceptable. This failure directly violates HIPAA requirement for covered entities to conduct risk analyses and implement appropriate safeguards to protect PHI. Such an oversight could lead to significant data breaches, resulting in substantial fines, reputational damage, and loss of patient trust. Another incorrect approach that bypasses legal and IT review in favor of rapid adoption ignores the critical need for due diligence. Haste can lead to the selection of technologies that are not interoperable with existing systems, lack necessary security features, or have unfavorable data sharing agreements, all of which can create vulnerabilities and compliance issues. A third incorrect approach that relies solely on vendor assurances without independent verification is also professionally unsound. While vendors are responsible for the security of their platforms, covered entities remain ultimately accountable for the protection of PHI. Failing to conduct independent due diligence on vendor security practices and contractual obligations can leave the practice exposed to risks that the vendor may not adequately address. The professional decision-making process for similar situations should involve a structured, risk-based approach. This includes 1. Clearly defining the practice's needs and objectives for technology integration. 2. Conducting a thorough risk assessment, identifying potential threats to PHI and evaluating existing vulnerabilities. 3. Engaging relevant stakeholders, including legal counsel, IT security experts, and clinical staff, throughout the evaluation process. 4. Performing due diligence on potential technology vendors, scrutinizing their security certifications, data handling policies, and contractual terms. 5. Developing a comprehensive implementation plan that includes robust training for all staff and a clear incident response protocol. 6. Regularly reviewing and updating technology and security measures to adapt to evolving threats and regulatory requirements. Question 17. Benchmark analysis indicates that physician practices face significant challenges in maintaining operational continuity and patient care during widespread emergencies. Considering the regulatory framework for Certified Physician Practice Managers, CPPM, which of the following approaches to emergency preparedness and response planning best aligns with compliance and professional best practices? Option A. Implementing a reactive strategy that focuses solely on immediate patient needs as they arise during an emergency, without a pre-established plan. Option B. Prioritizing only staff safety and operational shutdown during any declared emergency, suspending all patient services until the situation is fully resolved. Option C. Developing a comprehensive, documented emergency preparedness and response plan that includes communication protocols, resource management, patient tracking, and staff safety measures with regular review and drills. Option D. Relying on informal, ad hoc decision-making by practice leadership based on media reports and evolving circumstances during an emergency. The correct answer is C. Developing a comprehensive, documented emergency preparedness and response plan that includes communication protocols, resource management, patient tracking, and staff safety measures with regular review and drills. Explanation: scenario analysis. This scenario is professionally challenging because it requires a physician practice manager to balance immediate patient care needs with long-term operational resilience during an unforeseen, widespread disruption. The core challenge lies in prioritizing resource allocation, communication strategies, and staff safety while adhering to regulatory mandates for emergency preparedness and response. The practice manager must make critical decisions under pressure, often with incomplete information, to ensure continuity of care and compliance. Correct approach analysis. The correct approach emphasizes a proactive, multifaceted strategy that integrates established emergency preparedness frameworks with the specific operational realities of a physician practice. This involves developing a comprehensive plan that addresses communication protocols, resource management, including critical supplies and staffing, patient tracking, and staff well-being. Such a plan, grounded in regulatory requirements like those potentially outlined by HIPAA for contingency planning and state-specific healthcare emergency preparedness mandates, ensures that the practice can effectively respond to and recover from emergencies, minimizing disruption to patient care and safeguarding both patients and staff. This approach reflects best professional practice by prioritizing a systematic, documented, and regularly reviewed plan that aligns with legal obligations and ethical responsibilities. Incorrect approach is analysis. One incorrect approach focuses solely on immediate patient care without a structured emergency plan. This fails to meet regulatory requirements for preparedness, as it lacks documented procedures for communication, resource allocation, or long-term recovery. It also creates significant ethical risks by potentially leaving patients vulnerable during prolonged disruptions and failing to adequately protect staff. Another incorrect approach prioritizes only staff safety and operational shutdown, neglecting the critical need for continued patient care, especially for those with chronic conditions or requiring urgent attention. Staff safety is paramount. A complete cessation of services without a contingency plan for essential care delivery is a regulatory and ethical failure. It overlooks the practice's duty to its patient population and the broader healthcare system's needs during a crisis. A third incorrect approach relies on ad hoc decision-making based on current events without pre-existing protocols. This is a significant regulatory failure, as it demonstrates a lack of proactive planning and adherence to mandated preparedness standards. Ethically, it leads to inconsistent and potentially inequitable care delivery, as decisions are not guided by established principles or a comprehensive risk assessment. Professional reasoning. Professionals should adopt a decision-making framework that begins with understanding the applicable regulatory landscape for emergency preparedness and response in their specific jurisdiction. This involves identifying relevant federal e.g. HIPAA security rule regarding contingency planning and state-level healthcare emergency preparedness requirements. The next step is to conduct a thorough risk assessment to identify potential threats relevant to the practice's location and patient population. Based on this assessment, a comprehensive written emergency preparedness and response plan should be developed, covering communication, operations, staffing, patient management, and recovery. This plan must be regularly reviewed, updated, and practiced through drills and training. During an actual emergency, decision-making should be guided by this pre-established plan, adapting as necessary based on real-time information while always prioritizing patient safety, regulatory compliance, and staff well-being. Question 18. The performance metrics show a concerning trend of declining patient satisfaction scores over the past quarter, coupled with a significant increase in staff overtime hours. As a certified physician practice manager, what is the most appropriate initial course of action to address these interconnected issues? Option A. Initiate a comprehensive review of staffing levels, patient scheduling processes, and operational workflows, engaging frontline staff for input to identify areas for improvement and implement targeted solutions. Option B. Immediately implement a hiring freeze and mandate a reduction in non-essential services to control costs and alleviate staff workload. Option C. Dismiss the patient satisfaction dip as a minor fluctuation and focus solely on managing the overtime costs by reassigning tasks without investigating the underlying causes. Option D. Advise the physicians to simply work longer hours to cover the increased patient volume and improve patient satisfaction through personal attention. Correct answer is A. Initiate a comprehensive review of staffing levels, patient scheduling processes, and operational workflows, engaging frontline staff for input to identify areas for improvement and implement targeted solutions. Explanation. Scenario analysis. This scenario presents a common challenge for healthcare managers, balancing the need for efficient resource allocation with the ethical imperative to provide high-quality patient care. The performance metrics indicate a potential decline in patient satisfaction and an increase in staff overtime, suggesting a strain on the practice's operational capacity. A manager must navigate these competing demands, considering both financial sustainability and the well-being of patients and staff, all within the framework of applicable regulations and professional ethics. Correct approach analysis. The optimal approach involves a multifaceted strategy that directly addresses the root causes of the observed metrics. This includes a thorough review of staffing levels, patient scheduling efficiency, and the effectiveness of existing workflows. By engaging with frontline staff to gather insights and implementing targeted process improvements, the manager demonstrates a commitment to evidence-based decision-making and collaborative problem-solving. This aligns with the ethical responsibility to ensure adequate staffing for patient safety and to foster a supportive work environment, which are implicit in maintaining a high standard of care and operational integrity. Furthermore, proactive communication with stakeholders about the challenges and proposed solutions builds trust and transparency. Incorrect approaches analysis. One incorrect approach involves solely focusing on cost-cutting measures without a comprehensive understanding of their impact on patient care or staff morale. This could lead to further declines in satisfaction and increased burnout, potentially violating ethical obligations to provide quality care and maintain a safe working environment. It may also contravene specific regulations related to staffing ratios or patient access if not carefully managed. Another incorrect approach is to dismiss the performance metrics as temporary fluctuations without further investigation. This demonstrates a lack of due diligence and a failure to proactively manage operational risks. Ignoring these indicators could lead to a more significant crisis, potentially impacting the practice's compliance with regulatory standards for quality of care and patient safety. A third incorrect approach is to implement immediate drastic changes based on initial data without consulting staff or conducting a thorough analysis. This can create chaos, erode trust, and lead to unintended negative consequences. It fails to acknowledge the expertise of the staff who are directly involved in patient care and may overlook critical operational nuances, potentially leading to noncompliance with best practices in healthcare management and patient safety protocols. Professional reasoning. Professionals should approach such situations by adopting a systematic and data-driven problem-solving methodology. This involves 1. Data interpretation, thoroughly analyzing performance metrics to identify trends and potential root causes. 2. Stakeholder engagement, actively involving staff and potentially patients in the diagnostic process to gather qualitative insights. 3. Root cause analysis, employing tools and techniques to pinpoint the underlying issues contributing to the observed metrics. 4. Solution development, brainstorming and evaluating potential solutions that address the identified root causes, considering their impact on patient care, staff well-being, and financial viability. 5. Implementation and monitoring, executing chosen solutions and continuously monitoring their effectiveness, making adjustments as needed. 6. Communication, maintaining open and transparent communication with all stakeholders throughout the process. Question 19. The audit findings indicate a physician in the practice has requested access to a list of all patients who have received a specific type of elective cosmetic procedure within the last 2 years, stating they want to send out a general informational mailing about new advancements in that field. The practice manager is aware that no patient authorization has been obtained for this specific mailing purpose. Option A. Provide the physician with the requested patient list, assuming that as a physician, they understand the appropriate use of patient information. Option B. Inform the physician that the request is being reviewed and will be addressed once the practice manager has more time to investigate potential exceptions. Option C. Politely inform the physician that the request cannot be fulfilled as presented due to HIPAA regulations, and offer to provide information on the proper procedure for obtaining patient authorization for such mailings. Option D. Forward the request to the practice's IT department to generate the list, assuming the physician will handle the privacy aspects. The correct answer is C. Politely inform the physician that the request cannot be fulfilled as presented due to HIPAA regulations, and offer to provide information on the proper procedure for obtaining patient authorization for such mailings. Explanation. Scenario analysis. This scenario presents a common yet complex ethical and regulatory challenge in healthcare. The practice manager is caught between a physician's request for patient information for a non-treatment-related purpose and the stringent requirements of HIPAA. The challenge lies in balancing the physician's perceived authority and the practice's operational needs with the absolute legal and ethical obligation to protect patient privacy. Misinterpreting or mishandling this request can lead to significant legal penalties, reputational damage, and erosion of patient trust. Correct approach analysis. The correct approach involves a direct, professional, and regulatory compliant refusal of the physician's request, coupled with an offer to guide the physician through the proper HIPAA-compliant channels. This upholds the core principles of HIPAA, specifically the privacy rule, which mandates that protected health information, FI, can only be disclosed for specific purposes outlined in the regulation, such as treatment, payment, or healthcare operation, or with explicit patient authorization. By refusing the request and offering to explain the correct procedure, the practice manager demonstrates an understanding of their legal obligations and commitment to patient privacy, while also attempting to educate and guide the physician towards compliant behavior. This approach prioritizes patient rights and regulatory adherence above all else. Incorrect approach is analysis. One incorrect approach involves immediately providing the requested information. This is a direct violation of HIPAA. The physician's role does not automatically grant them access to PHI for purposes outside of direct patient care or authorized practice operations without proper authorization or a valid HIPAA exception. This action would constitute an impermissible disclosure of PHI, exposing the practice to significant fines and sanctions. Another incorrect approach is to delay the decision or attempt to find a workaround without consulting the HIPAA regulations or legal counsel. This indecisiveness can lead to accidental disclosures or create a perception of noncompliance. It fails to address the core issue of the improper request and leaves the practice vulnerable. A third incorrect approach is to dismiss the physician's request without offering any guidance or explanation. While the request is improper, a complete dismissal without education can create friction within the practice and may not prevent future similar requests. A more constructive approach involves educating the physician on the correct procedures. Professional reasoning. When faced with a request that potentially conflicts with regulatory requirements, a practice manager must first and foremost consult the governing regulations. In this case, HIPAA is the primary framework. The decision-making process should involve 1. Identifying the core issue. Is the request for PHI compliant with HIPAA? 2. Consulting the relevant regulations, specifically the HIPAA privacy rule regarding disclosures. 3. Assessing the risk. What are the potential consequences of compliance or non-compliance? 4. Communicating clearly and professionally. Refuse non-compliant requests directly and offer compliant alternatives or education. 5. Documenting the interaction. Keep a record of the request and the response. If there is any ambiguity, seeking guidance from legal counsel or a compliance officer is paramount. Question 20. Consider a scenario where a physician practice is located in a region prone to severe weather events, such as hurricanes. The practice has experienced minor disruptions in the past due to power outages and localized flooding, but has never formally developed a comprehensive emergency preparedness and response plan beyond basic staff communication. What is the most appropriate approach for the certified physician practice manager to ensure the practice is adequately prepared for future, potentially more severe, emergencies? Option A. Focus solely on ensuring the practice has a reliable backup generator and sufficient medical supplies, assuming these are the primary needs during any weather-related disruption. Option B. Create a basic communication tree for staff to call each other during an emergency, and instruct staff to use their best judgment to manage patient care and safety as best they can. Option C. Develop and implement a detailed emergency preparedness and response plan that includes communication protocols, evacuation procedures, shelter-in-place strategies, resource management, including backup power and supplies, staff training and regular drills, ensuring alignment with relevant U.S. healthcare regulations for emergency preparedness. Option D. Wait for a significant emergency event to occur, and then develop protocols based on the immediate needs and lessons learned from that specific incident. Correct answer is C. Develop and implement a detailed emergency preparedness and response plan that includes communication protocols, evacuation procedures, shelter-in-place strategies, resource management, including backup power and supplies, staff training and regular drills, ensuring alignment with relevant U.S. healthcare regulations for emergency preparedness. Explanation. Scenario analysis. This scenario presents a significant professional challenge for a certified physician practice manager, CPPM, due to the inherent unpredictability and potential severity of emergencies. The practice must balance maintaining patient care continuity with ensuring the safety of staff and patients during a crisis. The CPPM role is critical in proactively developing and implementing robust emergency preparedness and response protocols that align with regulatory requirements and ethical obligations to provide a safe healthcare environment. Failure to do so can lead to patient harm, operational disruption, legal repercussions, and reputational damage. Correct approach analysis. The correct approach involves a comprehensive, multifaceted strategy that prioritizes patient safety, staff well-being, and operational resilience. This includes establishing clear communication channels, defining roles and responsibilities, conducting regular drills and training, and ensuring adequate resources are available. Such an approach aligns with the fundamental principles of healthcare management and the ethical duty of care. Specifically, in the U.S. context, this would involve adherence to guidelines from agencies like the Department of Health and Human Services, HHS, and the Centers for Medicare and Medicaid Services, CMS, which mandate emergency preparedness for healthcare facilities to ensure patient safety and continuity of care during disasters. This proactive and systematic method demonstrates a commitment to regulatory compliance and best practices in risk management. Incorrect approach is analysis, an approach that solely focuses on immediate patient needs without a predefined plan for broader emergencies, fails to address the systemic risks associated with disasters. This neglects the regulatory requirement for comprehensive emergency preparedness, potentially leading to chaos, delayed or inadequate care, and increased patient vulnerability. An approach that relies on ad hoc decision-making during an emergency, without prior planning or established protocols, is highly problematic. This increases the likelihood of errors, inconsistent responses, and failure to account for critical safety measures. It directly contravenes the principles of organized emergency management and the regulatory expectation for documented practice procedures. An approach that prioritizes staff safety over immediate patient needs, while important, can be ethically and regulatorily challenging if not balanced within a comprehensive plan. While staff well-being is paramount, emergency protocols must also outline how patient care will be maintained or transferred safely during a crisis, as mandated by healthcare regulations. A complete disregard for patient care continuity during an emergency would be a significant failure. Professional reasoning. Professionals should adopt a proactive risk management framework. This involves identifying potential threats, assessing their impact, and developing mitigation strategies. For emergency preparedness, this means creating a detailed, documented plan that covers communication, evacuation, shelter-in-place, resource management, and post-event recovery. Regular training, drills, and plan updates are essential to ensure effectiveness and compliance with relevant U.S. healthcare regulations. The decision-making process should always weigh patient safety, staff well-being, and regulatory adherence, guided by a well-rehearsed and understood emergency plan.